Bismillah. In this video, we're going to be talking about some of the irreversible effects of creatine on a woman's body, and more so, the irreversible effects of not taking creatine. I'm going to share with you everything you need to know about creatine and why you should be taking this right now. I take creatine every day, and one of the reasons that I started taking creatine was I got scared. I was listening to this doctor do a video about your bones. She was saying that your bone loss can be prevented by using creatine, and that all women are going to experience bone loss starting from their age 30s. And this really scared me. And when I started looking into it, creatine did a whole lot more than just help your bones. So what is creatine? Creatine is 3 amino acids that work together. They are in your body naturally. You have them in your muscles, and you also have them in your liver, your kidneys, and in your brain. Most of it is in your muscle tissue because that's the larger amount of tissue. What it does, creatine helps to produce energy. It changes the ADP to ATP, which produces energy for all of your body functions. That's the basic part of it, but it does so much more than that. There are thousands of studies on creatine because of how much it can do for your body. So it's very, very well documented. And we're going to go over some of the studies that aren't ever talked about or mentioned that are very important for us women. Well, you're talking about bones. Now we're going to talk about muscles. Let me show you this graph here. 20s is your peak in early adulthood for your muscle mass. We gradually go downhill from there. And that you cannot have to go downhill because we can do something about it. So what does creatine do for our muscles? Please take a minute to like and subscribe. It will really help support the channel. Thank you. Well, it does help you with the basic stuff. It helps you to recover quicker from exercising. It helps to build your muscles. You won't lose your muscle tissue. Every year, like those graphs are showing, you can actually stop that from happening. But if you try and do it without creatine, this is what happens. If you're just exercising or lifting weight, especially as you start to continue aging, that estrogen thing just keeps getting in the way, and it causes you not to gain any muscle, not to grow any muscle, not to keep any muscle. It doesn't help. So you need that extra creatine to actually help that muscle to stick on your body. Why do you need that muscle? Muscle is what holds you together. It helps to hold your frame. It helps to activate that brain, your hormones, your energy. It helps to activate so many parts of your body to keep you alive. It's not just for looks. It does so much more for your body. So what about estrogen? Estrogen affects your creatine levels. When your estrogen levels change, you will need more creatine. And our estrogen levels change during our menstrual cycle, pregnancy, even lactation, also perimenopause and menopause. And here's what happens when you take creatine to help with those estrogen fluctuations. I went over this study. Now, this study was over women from ages 12 to 70, and they were given only 13 milligrams, not grams, milligrams of creatine a day. And what they found was it helped to improve their complete reproductive system. So helping you to have more regular periods, have less infections, helping you to have a better pregnancy. When you get older, sometimes you have to have hormone replacement therapy. So it helped to reduce your likelihood of having to have any kind of hormone replacement therapies. It just helped with the entire reproductive system of a woman. So what's the best kind? The best kind is creatine monohydrate, and this is the best form. I'll leave you a link for this one from iHerb, which is excellent. It's really good quality. It's 5 grams per serving, and it is pure monohydrate. So this is really good to be taking and will give you great effects if you start using this. I'll leave a link right there in the shopping cart. Go and get that. They're having a sale on this, so it's a great price. Go and check it out. Let's talk about your brain. Taking creatine for your brain, it helps to improve your overall brain health and function. Creatine can improve your memory, your long-term and short-term memory. It helps to increase your cognitive performance, and it aids in your recovery from any kind of brain injury. So if you have any mental health issues or worried about Alzheimer's disease or any of these dementia, dementia starts as early as in your 30s. Yeah, it's true. And most times it's undetected. So it's really good to start taking creatine, especially for us women, because we go through pregnancy. I've gone through 8 pregnancies. And yes, it does affect your brain. And a lot of women, we joke about it. Oh, I'm just lightheaded, or spacey today, or I just don't remember. But no, this is actually something you should not just wipe off. It's something you should be thinking about. Yeah, you should be taking creatine. You need to be improving that brain function, because if you're experiencing a lot of, oh, I just forgot, this is just your sign early on that you need to be taking creatine, because it can be leading to dementia and Alzheimer's quite quickly. So pay attention to those warning signs. Talk about another one that is not your typical reason for taking creatine, and that is your aging. Creatine helps to firm and tighten up your skin. And this is true. It's been shown in many studies. You can look in the Journal of Cosmetic Dermatology. It has been proven that creatine has helped to tighten up your skin, firm up your skin. It does increase your energy. It does help to reduce fatigue. It does help you look younger. Not only you look younger, feel younger. It helps to maintain your muscles. So the muscles in your face, as you age, those fat pads in your face, they start to disappear, as well as the muscle in your face, it will start to disappear. So taking creatine will help that muscle tissue to stay and look younger. And what's very important to make creatine work really well is to make sure you're doing some kind of weightlifting. You should do weightlifting, heavy lifting at least 3 times a week, no matter what age you are. It doesn't matter if heavy lifting to you is 10 pounds or 80 pounds. It doesn't matter. Just do it. It really helps to activate and give your body the message that it needs to strengthen up and build up your muscles and your bones. Some of the myths about creatine, let's talk about those. You're not going to get super bulky by taking creatine. You will not have to worry about what age you are. You can take creatine at any age, and there's no side effects. It's very safe. It's one of the safest supplements to be taking. If you have any kind of disease or problem with any of your organs, you can go and talk to your doctor about it, but it's pretty much safe for everyone. Something else I want to talk about is your mood and your depression. This is very good for helping with any kind of anxiety, tiredness. Creatine can really help to improve this for you. Because we make less, we need more, and we go through a lot more changes in our body that also need more. So what are some safe levels of creatine? So if you're thinking about taking creatine, which you better be, the best levels you should be taking is around 3 grams to 5 grams a day. If you're 60, 70, 80, you should probably be taking more around 8 grams of creatine a day. And you want the creatine to work better, you should do weightlifting with it. This will help to activate more of those activation centers in your body that, hey, creatine is coming in, we can use this. You can take creatine every day, and you can take it before and after you exercise. That sometimes helps to make sure it gets in the muscle. But you don't have to take it when you're exercising. You can take it anytime. About loading, you do not need to load up on creatine to get it started. Some people take like 5-10 doses in the very beginning to kind of get it in your system. You don't have to do that. You can just start with the 3 grams or 5 grams. What you will notice though is creatine does not work right away. You need to be taking it for at least 20-30 days before you start to notice some energy changes. Can you get creatine in your food? Yes, you can get creatine in your food. Let me give you an example. Creatine is mostly in meat. In a 3-ounce serving of beef, which is the highest, you're gonna get up to maximum of 1 gram of creatine. And that's maximum. Usually it's around 0.5 in a 3-ounce serving. So you really gotta eat a lot of meat to be able to get it in just your food. I wish I knew about creatine when I was in my 20s. I sure would have been taking it then. And if you know anyone in their 20s, make sure you tell them this is very important to start taking it when you're 20 and keep on going from there. All of you women should be taking it. I don't know how much better our lives would have been if we would have known this from the beginning. So make sure you share this with every woman you know. They need to start taking creatine. And our diets today, whether you think you're a healthy person or not, just doesn't have the nutrients in it that it used to. And I'm sure in the future, our need for creatine will probably rise to more 12 grams instead of the 5, as our nutrition in our food just continues to decline. Leave me some comments down below if you're using it already. And creatine is even safe for people to take if they're pregnant, and it helps with the brain development of the baby. Did you know that? So many important things that creatine can do for your body and your baby. Alright, I don't know if I covered everything, but I tried. Leave me some comments down below. If you have any more questions that I didn't cover, I'll be happy to answer them, so we leave some more information for everyone else watching.